I had chronic knee pain for 5 years. I had a knee surgery, ACL meniscus damage, tendonitis, and for all those 5 years I had chronic pain, and I was told to rest, to ice, to compress, to elevate. Some of those are bad, some of those are not so much. Rest and the icing is really not good for you. So I'm going to give you today 3 exercises which you can do pretty much every single day to kind of help the knee to heal, help it to recover. The aim of the game is blood flow. Movement is medicine rather than rest and ice, which we've been taught. Movement is medicine. So you're probably asking like why I'm qualified to actually speak on this topic. But as I just said, I had all of that damage in my knee, and now my knees are absolutely pain-free. I'm playing football, I'm doing whatever I want to do. And these 3 exercises I've done pretty much every day for the last like 2 or 3 years. They've been a massive factor for me being able to overcome my knee pain, to overcome my knee issues. And I've also been using them with all my clients as well. And they've seen amazing results from it. From doing this stuff, some people have got off painkillers within 3 weeks. So there's 3 exercises, and all of them are getting work to the area without breaking down the tissues too much. So the first one is an isometric. So when we go on the eccentric, so the down portion of a movement, that's when the tissues kind of break down. So if we're holding it in place and we're using this isometric, it's getting work inside the connective tissue, inside of the knee. It's building stronger tendons, stronger ligaments, stronger knees. So you can literally do this and then the next day do it again and you wouldn't have any adverse effects. The second is a concentric dominant movement. If you've been dealing with knee issues, you've probably seen Ben Patrick talk about the sled a lot, talk about backwards walking. Those are 2 absolute great options. So if you do have a turned off treadmill, you can use that. If you have a sled, you can use that and go backwards on it every day. If you don't have either of those, band and knee extensions for me have been a game changer. The bands pull you down into the lift, so you're not using that eccentric portion. You're bypassing it from the bands pulling you down into it, and then you're just using that concentric. So we're using this knee in a short range of motion, a concentric dominant, and it's not breaking down the tissues, but it's getting loads of blood flow. If you do 50, 100, 200 reps of this, your quads are gonna be on fire and your knee's gonna pretty much have an instant pain relief. I've been doing these every day for the last year or so, and it's been an absolute game changer. Then the last is flossing. So you've probably seen me and other people talk about these floss bands loads and loads. If you haven't purchased them yet, you need to. They're like 20 quid off Amazon, and they're an absolute game changer for knee health. There's 2 benefits to it. So obviously there's the blood flow restriction training. So when you take them off, there's all the blood flows into the knee and it gets that heat, gets that warmth to the area. The other is that it actually allows us to get into a deeper range of motion. You can use these floss bands pretty much every day. I like the squats. For people that are brand new and they're coming off knee injuries, I'd get them to just go to whatever range is comfortable. If that's here, that's here. If that's here, that's here. If that's here, that's here. But eventually we want to be able to get the full range of motion. If you want to use assistance, you can. Just squat 10 to 20 times. This is not going to cause too much breakdown. It's just a movement. It's just squat. You do 1 set of that, 10 to 20 reps. You take the bands off, your knee's going to be feeling so much better. I'd recommend doing these 1 to 2 times a day. Make it a habit like you brush your teeth. Like when we're sleeping overnight, our knees in one position all night. So this is kind of how I start my day. It's to stop that stiffness, to get rid of any pain in the morning, get us going. So when we are going throughout our day, we feel a lot better. And then the other one is like just before I go to bed at night. Those are the 2 times I'd do it. Don't absolutely destroy yourself, just get blood flow in the area and get the movement in without causing any tissue breakdown. But yeah, this is going to be a game changer for you if you do have knee pain. Make sure that you make this a habit. Do stuff every day for the knee, do the movement, go for a walk, go for a backwards walk, floss, band and knee extensions, this kind of stuff. Keep getting pain-free movement in. That's going to be the medicine for the knee. I'm constantly doing mobility. I'm constantly moving the knee around, constantly putting some pressure on it, just light stuff, making sure it's working, not avoiding it. If you look at people that are coming off knee surgeries or people that have been in pain for years, they're avoiding their knee. They'll go up the stairs sideways. When they walk, they'll walk with a bit of a limp so they don't have to put too much pressure on the knee. So you want to find however much pressure you can put on the knee, but at the level that's pain-free and that you can handle it. From there, you just progress over time. Do 2 to 3 leg days a week, and then these exercises every day. Some mobility, maybe 1, 2, 3 times a week, and you're going to be solid, especially if you're progressively loading it. Graded exposure is the name of the game for knee health. And if you want my help to overcome any knee issues, to overcome knee pain, then the link to apply for my coaching is going to be in the top line in the description. We're only taking a limited amount of people a month because we have a lot of demand. So the sooner you fill that in, the sooner I'll be able to get back to you, and the quicker you may be able to be in the coaching, actually working to get out of knee pain, to get back to sport, to regain your life that you had lost.